recorded. We will have the slides and recording available within a few days on our website. I also want to mention you are currently muted. However, when we get to the Q&A portion of this presentation, you can raise your hand and I can unmute you, or you can type your question or comment in the comment box. I also want to mention, in order to get your CE credits, you will need to use the sign out link that you received via email. I will also share the link in the chat box towards the end of the session. You will complete that sign out survey, and then you will be sent to the evaluation for the presentation. We ask that you please complete the evaluation to help us make sure we're providing information that you are looking for, as well as help plan for future webinars. Again, thank you for joining us this afternoon, and I will turn it over to Victoria.
Thank you so much, Courtney, and thank you all for being here today. Hello, OCO. My name is Victoria O'Keefe Dawado. I am a member of the Cherokee and Seminole Nations of Oklahoma, and I just really want to thank the National Indian Health Board for the invitation to present today and for putting on this really important learning event that we're all here for. I'm really excited to share a recently released project that our Center for American Indian Health has worked on, called Culture Forward, and it focuses on cultural strengths to prevent Native youth suicide. I want to start by just saying that as we gather together in this virtual space from across the country, I want to acknowledge that we're all on Indigenous lands, we're all on Native lands, and just acknowledge that today. I also want to provide a little bit of context about who I am and why I do this work. I'm really motivated and committed to this work through my tribal values as a Cherokee and Seminole woman. One of these Cherokee values and community values that really guides my work is Gadugi, which means people coming together and working to help one another. This is a community value that's been instilled in me by my mother, who's pictured on the bottom left of this slide, as well as my late grandma, who you see pictured on the bottom right of this slide. My late grandma was a community health worker for our tribe. She was a Cherokee speaker, a first speaker, and a fluent speaker, and really proud of the work that she did for Cherokee Nation. And my mother has always made sure that I know who I am as a Cherokee and Seminole woman and to advocate for our communities. So my commitment and my advocacy around public health, around mental health and community wellness and health equity were all passed on to me by the incredibly strong women in my family. So this is just an overview or a roadmap of my talk today. I'm going to start by introducing you all to the Johns Hopkins Center for American Indian Health and tell you about some of our major areas of work, and especially with a focus to our mental health work that we do. I'm also going to provide some background about what we know about suicide rates among Native communities in the US, as well as we know about Native youth in particular. And then I'm going to spend a little bit of time talking about the importance of protective factors and strengths approaches to suicide prevention. We know these approaches are important with what we hear from communities. We also know it's very important given the research and programs that are happening throughout Indian country. And then I'll spend the majority of the talk talking about this new resource that we just released called Culture Forward. It's a free online guide that anyone can access on our website. I'll talk about why we developed it and how we developed it using a community engaged approach. I'll talk about the content and the structure, so what's actually included in this guide. I'll talk about 5 core themes that became chapters for our guide and how we got to those themes. And then I'll talk about how you can access Culture Forward. So starting off, our Johns Hopkins Center for American Indian Health was founded in 1991 at the Johns Hopkins Bloomberg School of Public Health, which is the first, largest, and #1 school of public health in the world. And our center was founded by Dr. Matu Santosham, who's an infectious disease prevention pediatrician, based on more than 10 years of work that he had already been doing with Southwest tribes in the 1980s. And over time, the trusting partnership that he forged with communities has led to many other areas of work, including mental health work. Our Center for American Indian Health also has a memorandum of understanding with Indian Health Service, and this dates back to 1991. This allows us to work directly with IHS on various programs and research and be able to share those programs and research with IHS clinics across the country. And our mission is to work in partnership with American Indian and Alaska Native communities to raise Native health status, self-sufficiency, and health leadership of Native peoples to the highest possible level. This map just gives you a sense of some of where our work is taking place. So in the maroon boxes are where we have all of our offices. So we have an office in Baltimore, Maryland, where the Johns Hopkins University is located. We also have a brand new office in Duluth, Minnesota. And we have a number of offices across the Southwest on Navajo Nation, as well as White Mountain Apache lands, and Albuquerque, New Mexico. And our center's work, our programs, and our research have reached more than 140 tribal communities and urban Native communities across 21 states, and that continues to grow. So it's really amazing, and it's a privilege to be a part of our center. Our center has a few main core areas. As I mentioned, Dr. Santosham, his work really started in infectious disease prevention work, especially with youth. However, over time, tribal community partners and urban Native community partners have expressed their priorities around mental health and behavioral health. So our work has expanded to these areas. And then we also have a strong training program. One of our goals and one of our values at the center is to train the current and next generation of Indigenous public health scholars and leaders. So to hone in on our mental health team in particular, which is the team that I'm a part of at the Center for American Indian Health, I'll talk about our suicide prevention work next, which has been ongoing since the 1990s. But I do want to point out that over the last year and a few months, our mental health team has really focused on providing mental health promotion resources during the COVID-19 pandemic. So I have just two examples. We have many others on our website if you're interested, but some of our newer work related to mental health promotion during the pandemic is on the left is psychological first aid for COVID-19 frontline workers. So this is a guide that we culturally adapted with an all Native team across the country, including many frontline workers themselves. And so this is a free online guide, and we have a free online training for any frontline worker who's working in Native communities available on our website. On the right, this is a project that's very near and dear to my heart. We, during the pandemic, we developed 2 storybooks for Indigenous children and families. And the first book was called Our Smallest Warriors, Our Strongest Medicine, Overcoming COVID-19. And this picture right here on the right, this is the cover of our newest sequel, which we actually just launched last week, titled Our Smallest Warriors, Our Strongest Medicine, Honoring Our Teachings During COVID-19. So these 2 books are available on our website for free as an e-reader. We've already distributed more than 40,000 copies of the first book to tribal communities and urban Native communities across the country. We currently have 20,000 pre-orders of our sequel book. So if you're interested in this resource as well, it's been very popular. And we weave together public health, mental health coping strategies, as well as shared cultural teachings across tribes. And this was also developed with a fully Native work group and a amazing Native youth illustrator who produced the illustrations. So this has been a lot of our work on the mental health team over the last year. However, we have always had a strong emphasis on suicide prevention work with our mental health team as well. And again, this is largely driven by our tribal community partners who are prioritizing this in their communities. So we have a number of community-driven suicide prevention interventions and resources to reduce risk and promote protective factors among Native youth. And so one of our bigger projects is funded by the National Institute of Health, and it's called the Southwest Hub for American Indian Youth Suicide Prevention Research. And these are just a few of our tribal partners pictured here who are involved in this amazing project. And so the resource that I'm talking today pertains to cultural strengths as protective against suicide. And why are we talking about suicide? I'm sure many people who are attending today know that Native communities are disproportionately impacted by suicide. So this graph depicts some recent data from CDC. And you can see American Indian and Alaska Native suicide rates are depicted in the green line. And the general population suicide rates are depicted in the black line. And what you can see over time, this is from 2009 to 2018, is that consistently over time, American Indians and Alaska Natives as a group have had higher suicide rates compared to the general population. Of course, there are important differences depending on tribe, depending on community. Not all tribal communities or all urban Native communities have high suicide rates. Some have low suicide rates. However, as an aggregate group, we see that Native communities compared to the general population have higher suicide rates. This graph also looks at recent suicide rate data by age and by race. So in the green bars are American Indian and Alaska Native suicide rates, and in the black bars is the general population. And what we know is that we know this from communities, we know this from data, we know this from research, that youth and young adults are the group among Native communities that tend to be at highest risk for suicide. So a lot of resources and a lot of programs tend to focus on this younger age group. It's also really important that we target this group because in many of our tribal communities, there are values and beliefs about how youth are sacred, how there are future leaders, and how they're vital to our community's health and wellness. So this framework that I have on this slide comes from an Indigenous researcher, Dr. Jessica Ulrich, and she developed an Indigenous connectedness framework. And what she did was she showed how these shared concepts of well-being across Indigenous communities are so vital for child well-being. And she further goes on to say that child well-being and community well-being go hand in hand and they work together. So this again is another reason that we need to prioritize suicide prevention, especially among our youth. The other reason that it's important to address suicide prevention with Native youth is that Native youth themselves are saying this is a priority of theirs. There was a report by the Center for Native American Youth at the Aspen Institute in 2018. And in their work with Native youth, they found that Indigenous youth are saying that they are concerned about suicide risk among their peers. In a more recent national survey with 1,100 Indigenous youth, their top priority that they identified was improving mental health and wellness. And this was the Indigenous Futures research team led by Illuminative recently. So we know that Native youth are really concerned about suicide risk, and they're also wanting to focus on mental health promotion and wellness. Touching on a bit of the research, as I mentioned, it's important to take an approach of promoting protective factors and promoting strengths-based approaches to suicide prevention. There was a study conducted in 1999 by Dr. Borowski and colleagues, and this was a study that was conducted with more than 11,000 Native youth in grades 7 through 12. And what this research team found was that promoting protective factors against Native youth suicide was actually more important than reducing risk factors. In another article by Dr. Lisa Wexler and colleagues, they emphasize the importance of taking a community-based approach to suicide prevention, as well as a strengths-based approach to Native youth suicide prevention. So I'm going to spend the rest of this talk really focusing on taking a community engaged approach and a strengths-based approach, and how we did that with this current project that we just recently released, this resource guide called Culture Forward, a strengths and culture-based tool to protect our Native youth from suicide. So this is the front cover of our guide. This project was commissioned and funded by Casey Family Programs. We started this project in 2018, and we released the guide just a few months ago in April 2021. And as you can see from the front cover of the guide, our major theme in terms of graphic design was weaving. This is because many tribes have traditions around weaving, whether that's baskets or rugs or nets for catching fish or other food. And we thought that this was a nice theme that many tribes or many urban Native peoples could relate to. And we see this guide as weaving together knowledges, stories, best practices, and practical resources for Native communities when it comes to Native youth suicide prevention. So I'm excited to share how we developed this guide, what's included inside, and how you can access the guide. So as I mentioned, it's really important to take a community engaged process when doing suicide prevention work. And that's what we wanted to do with this project. We came to this wanting to know from communities, if you had a resource guide, what would you want included in it? What's important to include? What do you want to highlight? And how should this be disseminated? What's the best way that we can get this guide out to tribal leaders, to grassroots leaders, to communities to access this? And that's what we did through this first phase of formative information gathering. So we held several listening sessions, which included 9 community roundtables and 8 interviews. And we did this with tribal leaders, grassroots leaders who are doing suicide prevention work in their own communities. We also wanted to highlight Native youth voices to understand from them what should be included in this guide and how do we get this out. We also had some listening sessions with traditional healers and elders, as well as 2 spirit leaders. We also scanned and updated the existing reports on what we know about suicide rates among Native youth and trends, as well as evidence-based and culturally driven best practices. So we ended up having 60 Native participants in our listening sessions who represented 36 tribal communities, and folks came from many different places. We had participants from reservations, from off-reservation, from rural communities, from urban communities. We tried to get a really diverse representation so that we could understand how can this be most effective with folks from communities all over. And this graph just shows what our listening process looked like. So in the purple dots, these are community roundtables that we held. And in the blue, these are individual interviews that we had. And you can see we did this, we held this process of listening sessions for approximately 5 to 6 months. We also convened a national editorial advisory board to ensure that this resource is fully guided by Native communities and suicide prevention experts. So this group provided us with feedback as we were drafting the guide. They provided written feedback. Many of them read each chapter and provided written feedback for us. And they also looked at the graphic design of the guide, the themes that we were moving towards to let us know what was most appropriate and what they thought was most effective. So in terms of how we developed culture forward content, we took all of those listening sessions that we held and we had audio recorded them. We de-identified everything and we transcribed them so that we could see what are we learning from all of these listening sessions. So we had 2 research assistants who coded all of the data and they pulled out what were the key themes that we heard from everyone. So this was a really iterative and collaborative process with our team to develop this code book and then apply them to all of the transcripts and hear the voices from these listening sessions. And this is probably not surprising to many people, but the overall theme that emerged from all of these listening sessions was the importance of culture to promote Native youth mental health and to prevent suicide. And I can say I co-led every single listening session and interview, and sitting in all of those listening sessions, that we were constantly talking about the importance of culture. So it's not surprising that this came out as the overall theme, and this inspired the title Culture Forward. What we also did with those themes is that from that data from the listening sessions, those qualitative themes then became 5 main chapters for the guide. And I'll go through what each of those chapters are in just a little bit. Within each chapter, we have an introduction to what that theme is, why that particular theme is helpful to prevent Native youth suicide. We review academic literature and what we know from research. We also highlight some community stories and programs. There's about 2 to 3 community stories and programs that demonstrate that theme within each chapter. We also provide a box with action steps that communities can take. And then we also have a section of additional resources that are publicly available so that if individuals want to know more about what else is out there, or what else they can read on that particular chapter, that particular theme, then they can go access that. And then I also want to mention and give gratitude to our amazing graphic design team, Nuna Consulting Group, which is a minority woman-owned business, and many of the graphic designers on the team were Native as well, which was important to us. So the 5 core themes, again, these came from our listening sessions, and looking across all of these listening sessions, these were the 5 themes that came out of those listening sessions and became the 5 main chapters of this guide. So the first theme is our networks harness belonging and help keep us safe. The second is connections to our lands and elders allow us to thrive. The third theme is traditional knowledge holds the keys to health and healing. The fourth is Native youth lead us to reclaim our autonomy and well-being. And the fifth is self-determination empowers us to fight. And so we depicted these 5 themes in a basket form. And so you can see each of these themes represents these reeds that come together to form Culture Forward. This is our table of contents. So I just wanted to briefly show you what we have in here. So we start with a foreword that was written by former Congresswoman, now Interior Secretary of the Interior, Deb Haaland. This actually was an idea from one of our listening session participants, and they had shared, you know, if you really want folks to get excited about this guide, if you want them to read it and you want them to open this up, you should have someone who's really inspirational to Native communities or who's influential, who's a role model to Native communities. And so we were so fortunate that former Congresswoman and now Secretary Deb Haaland and her team provided a written foreword and a video that I'll show you next. So after the foreword, we have an introduction. So why we wrote this guide and what's included and what our mission is with this guide. We then have a chapter about background, which summarizes what we know about Native youth suicide in terms of suicide rates, trends, patterns, what we know from research, what we know from what's happening in communities. And then we have those 5 chapters, those 5 core themes. Then we have how we keep moving culture forward. That's sort of just a conclusion chapter and what we hope this guide provides. And then a bibliography with all of our references. So I just want to take a moment to share the video that Deb Holland produced about this guide.
Hello, I'm Deb Holland, representative for New Mexico's 1st Congressional District and a member of Laguna Pueblo. Thank you for the opportunity to share a few words for the Culture Forward Guide. We know that suicide is an epidemic that affects Native youth at disproportionate rates, and our communities are losing bright young people with all the potential to make the world a better place. The work that Johns Hopkins Center for American Indian Health does to train professionals, research interventions, and empower communities to address suicide with culturally relevant resources can make a difference. I know our communities are resilient and that we can overcome this obstacle so that any young person, no matter where they live, knows that they are valued and that they have a future worth living for. I want to thank you all for the work you're doing to curb suicide among Native youth. I wish you all the best as you work to use cultural inspiration to develop creative and effective approaches to help our communities grapple with this issue.
So we were just so grateful and so privileged to have this video and a foreword by Deb Holland. It's really amazing and powerful.
Hello, I'm Deb Holland, representative.
Okay, so now I want to go through the 5 core themes. So again, these are the themes we derived from our listening sessions and are the main chapters of Culture Forward. So the first, talking about belongingness and networks. What we found is that family and community networks create belongingness, which is a critical protective factor and help to reduce suicide risks. So again, within each of these chapters, we have action steps. So for example, within this chapter, an action step might be for communities to support programs that strengthen youth connections and belongingness to their families, to their school, to their community, and to their tribe. Another example is conducting trainings that connect and build networks of helpers within communities. And so one of the community stories that we highlight within this particular chapter is about the White Mountain Apache tribe and their elders resilience curriculum that they developed. So this is an amazing program where White Mountain Apache elders go into schools every month and teach lessons that are 45 minutes to an hour in length. And they teach youth about Apache culture, language, and ways of life. And they've been doing this since 2014, and they've reached over 1,000 youth in schools. And this is just one example of how networks harness belonging and focusing on school belonging, community belonging, and belonging to culture. The next theme is connections to our lands and elders allow us to thrive. So this focuses on programs that promote connections to lands and elders and emphasizes traditional knowledges that are successful at preventing suicide and promoting resilience. So one of the example action steps is to develop programs if they're not already in existence, or support programs that promote protective factors through teachings and land-based activities with youth. So one community story that we highlight within this chapter is the Healing of the Canoe Project, which is a collaboration between some Pacific Northwest tribes and the University of Washington. And this particular program is focused on the canoe journey, which is an important cultural practice and guide to life for many Coast Salish tribes. And so the canoe journey is used as a metaphor for this program and connects to the curriculum of this program. It includes historical and contemporary connections to lands, ancestral knowledge, and elders. And the curriculum focuses on 4 domains of living a healthy life: mental, emotional, physical, and spiritual. The lessons are steeped in traditional tribal values, practices, and knowledges that impart teachings about the importance of community, managing emotions, solving problems in community, communicating, among many other things. The third theme is traditional knowledge holds the keys to health and well-being. So this theme really focuses on reclaiming traditional knowledges and cultural practices and values that actively work against historical trauma and its lasting impacts, including suicide. So some of the action steps within this particular chapter are rekindling and promoting values that embrace the important roles that Two-Spirit community members hold, forming an elders council and including traditional leaders to plan and participate cultural activities, and then culture camps for youth with special priority for any youth who might be at risk. And these culture camps are one of the community stories that we highlighted in this chapter. And there's many culture camps happening across communities. And we just give one example in Northwest Alaska, where culture camps have been happening since 2010. And within these particular culture camps, they bring approximately 12 to 25 Alaska Native youth at a time to 5-day camps across different sites away from their villages. The youth that are prioritized for participating in these programs have experienced things like being in foster care or being exposed to recent violence or even grieving a death by suicide. So they're given top priority to attend these camps. And at the camps, they have elders and they have traditional healers who guide them through cultural practices and wellness activities. And they also have team building exercises. So they are starting to do some pilot evaluation of programs like this, including this one in Northwest Alaska. And what they're finding is that youth participants who are in these culture camps are experiencing improved mood, feeling a greater sense of belonging, and feeling like they can better handle life stress. And all of these outcomes have been linked to lower suicide risk. The next theme and chapter in the guide is Native Youth Lead Us to Reclaim Our Autonomy and Well-Being. So this really focuses on how our youth are very strong, they're resilient, and they're also the future of our communities. So some action steps within this chapter are that we can encourage parents and community leaders to attend youth events to bolster or increase youth self-esteem. Many communities already have youth councils, but if a community doesn't have a youth council, that's one of the potential action steps. And then identifying suicide prevention resources that exist or are needed. So the community story that we highlight within this chapter is an amazing program called Native Hope, Helping Our People Endure. So this is a strengths-based Native youth leadership program that builds networks of youth natural helpers or peer helpers to prevent suicide. So there are adult leaders, which can be teachers or counselors or traditional healers or spiritual leaders, and they help guide youth through this curriculum and support them as youth really lead a community-based approach to suicide prevention. So they talk about training prevention strategies at multiple levels and breaking codes of silence about suicide among youth. And this amazing program has been delivered to approximately 2,000 youth in both reservation communities and urban communities. And evaluation has shown that this particular program has found increased traditional culture, resilience, community attachment, and intergenerational connectedness after participating. And the last theme is self-determination empowers us to fight. So this chapter and theme really focuses on the importance of self-determination and self-governance as a protective factor against suicide, and that tribal leaders can leverage tribal sovereignty to protect against suicide. So some potential ideas for action steps are that tribes can pass tribal resolutions or mandates that address suicide prevention within their community. Another example is tribal youth have voiced the importance of tribal leaders meeting with youth councils, working with youth councils, and attending youth events to show their support and their concern for Native youth within the community. So one example within this theme that we highlight in this chapter is the White Mountain Apache tribe, which mandated a community-based suicide surveillance and case management system. So in 2001, the White Mountain Apache Tribal Council passed a tribal resolution that mandates anyone living or working on the reservation to report all self-harm and suicidal behavior to a central data registry. There's an amazing team of White Mountain Apache community mental health specialists who are called the Celebrating Life team, and they follow up with each person who is reported to the system. And when they meet with individuals, they fill really important gaps. They can connect folks to mental health services within the community. They also educate the community about suicide prevention. And overall, this system of community-based surveillance is really the first of its kind in the world. And their community has seen decreased suicide rates over time because of the surveillance and case management system, as well as a public health approach to suicide within the community. But this wouldn't have been possible without tribal sovereignty and without that mandate by tribal council. So in conclusion, it's really important, it's vital to ensure that suicide prevention research and programs reach tribal communities and urban Native communities in ways that are practical and accessible through written and visual formats. That's really what we hope to achieve with the Culture Forward resource guide. Also, Culture Forward is an innovative cultural strengths-based resource guide for tribal leaders and for all community stakeholders to support youth suicide prevention efforts. We also used a community engaged process. We really listened to many voices and many stories from across tribes, across professional and community roles, and across diverse geographies to inform this guide. And Culture Forward honors and empowers communities by weaving together strands of knowledge, stories, and practical resources highlighting Native community strengths. So if you're interested in checking out Culture Forward, we have a free PDF available on our Johns Hopkins Center for American Indian Health website, and I have the direct link here. And we also have, I'll share a very limited amount of print copies. I don't know if you can see my video, but I'm holding up the guide right here. So this is the actual print guide. So if you're interested, if you work for an organization or a department that might benefit from having actual physical copies of this guide, we have a limited amount available. And we have a survey where you can request print copies, and I have that on this slide as well. I also want to acknowledge everyone who made this project and this resource guide possible. So all of my colleagues at the Johns Hopkins Center for American Indian Health. This report was made possible in collaboration with Casey Family Programs, an operating foundation committed to supporting tribes and strengthening tribal nations' capacity to keep children healthy, safe, and connected with their families, communities, and cultures. And I also want to acknowledge and thank the Nuna Consulting Group for their guide development and graphic design, led by Ricky McCarroll with contributions from the late Sean Quaney and Tara Branson. And I just want to express our deep gratitude for everyone who participated in our listening sessions and our National Advisory Editorial Board, for everyone for sharing their stories and their voices for this important project. So that's what I have. I want to say thank you, Ado, and I'm happy to take some questions.
Just a reminder, you can type your questions or comments in the chat box, or if you raise your hand, I can unmute you if you prefer to ask verbally. Someone did ask for the links that you just mentioned to the PDF. or to order, if you could put those in the chat box.
Yes, I am happy to do that.
Someone has their hand raised. You can unmute.
Hi, my name is Melissa Paulus Chacon in Victoria. I'd like to just thank you for this wonderful presentation and the hard work of everybody to produce this report. So I'm looking forward to getting a copy and sharing it. I work in youth prevention for 25 years with Native communities, urban and tribal. I'm really interested in actually getting the most current data we have on youth suicide, either attempts or actual suicide. And I'd like to look at it by gender. And I was just curious if you knew where to best access that information, because some of the sources I think are should have it, maybe don't have it for us yet.
Yeah, thank you so much, Melissa, for your kind words and for all of your amazing work working with youth prevention. And that's a great question. I think there is an issue of what data is available. So I think some of the Centers for Disease Control Prevention data is very limited. I'm sure many people on this call know that it only includes certain states. Again, tribes have sovereignty over their data. So if they don't want to share, it doesn't mean that, you know, the state or across the country that we have all of that data available. I will say, I think one of the resources that I would point to is the Suicide Prevention Resource Center. That's where I pulled those two graphs in my presentation from. And they look at CDC data, but they break it down and they have some really nice graphs that also look at rates of suicide ideation and suicide attempts. I can't remember if they break it down by gender, but that's one particular place that I would start. So I hope that's helpful.
Yes, it is. Thank you for clarifying that too, that the other group is using CDC's data and helping to break it down. So I'll look into that. Thank you.
Thank you.
There is a request for your email address as well, Victoria.
Sure, I will pop that in the chat.
We do have a question. Can you talk about the process for establishing safety with your community members as they attended the listening sessions and talking about suicide as a stigmatized topic?
Yeah, thank you for that question. That's a great question. With all of our listening sessions, we had a protocol and we had a guide about how we were going to talk about this with communities. And we opened it up with a prayer. Usually that was by an elder within the listening sessions. I'm also a trained clinical psychologist, so I'm prepared. I'm a licensed psychologist, so I'm prepared to ensure that everyone felt safe in the room. I'm very trained to be attuned to those things from doing therapy and group therapy. We did some debriefing afterwards with everyone. We also shared food before and after, and folks could stay and chat with me. But as you can imagine, there are many personal stories that come out when individuals talk about suicide, either themselves or family or community experiences. So through my own training and through our group, the way that we addressed it was just really being attuned to that and to ensure that everyone felt safe to leave as well.
Another question. How did you incorporate level of community readiness to address suicide in recruiting community participants to the listening session?
Yeah, I think we were very explicit in when we advertised what these listening sessions were about. We said that this would be about suicide. We had the guide that I just explained. We talked about that at the beginning about what we would be talking about, what our goal was for the session. And again, just having debriefing and ensuring that everyone felt safe to leave. Thank you for the questions.
If there's any more questions, please feel free again to type them in the chat box or raise your hand and we can unmute you. While we're waiting, the recording and the slides will be available within a few days on the NIHB webpage. So please be on the lookout for those. You can unmute.
Thank you, Courtney. I wanted to ask about one of the programs that you spoke about as an example. And I was curious about the Native Hope program and whether that has been evaluated so it can be replicated as an evidence-based approach, or where that is, because I was really interested in that model.
Yeah, absolutely. So what we found from some of our research looking into that program is that the group who developed that program does have some evaluation. So they described several studies that have found those outcomes like increased traditional culture, increased resilience, increased community attachment, and intergenerational connectedness after participating. And I believe that this was developed by the One Sky Center. I have it in the slide, and it's also included in the Culture Forward guide directly. So hopefully that provides you with a resource that if you're interested in finding some of those evaluation studies or contacting that particular team, that would give you that resource to see what is the evaluation around that program.
Okay, thank you. Just to follow up too, do you feel or do you know whether they might have their program set up in materials that we can train from or adopt, some of the design of the program as a model?
Yeah, this is one particular program where I think you might have to contact them directly. I don't think they have the curriculum online publicly available. At least that was my recollection. Some of the curriculum is available online for other programs. For example, I think the Healing of the Canoe Journey curriculum, they might have some of that posted online, but that's another one where you might have to contact the group, and they do trainings if that's a particular program that you want to have with any youth groups that you work with in the community.
Okay, thank you. And somebody did some research while you were talking and found the link to the training manual for Native Hope. So that's in the chat box now.
Yes, thank you.
Are there any other questions or comments anyone would like to share? While we wait, I will be posting the link to the sign out just for your convenience. You also would have received it via email. And as I mentioned before, you will need to use that at the end of the session to sign out and complete the evaluation and answer those questions in order to receive your CE credits. So if you give me one moment, I will post the link just for your convenience. There are a few comments saying thank you for your research and they really enjoyed your presentation.
Thank you. I appreciate everyone, and I know that a lot of you are working in your own community or working in other communities. So I just want to thank all of you for all of your important work, and we learn so much from you all of the time as well. The link to hard copies is, I will put it in again. It's this bit.ly link, and I'm putting it in the chat right now. So that will bring you directly to the survey that just asks name, organization, and how many copies that you would like.
I just posted the sign out link in the chat box as well. If there's no additional questions or comments, we can wrap up for the day. I want to thank everyone for joining us for our behavioral health learning event. I hope you enjoyed all of the sessions that you attended. If you have any questions or comments after today is over, please feel free to email me and I can assist with questions about the CE credits or anything else you may need, or if you're looking for the recordings and the slides on our webpage, I can direct you to where those will be as well. If you have any specific questions about the presentation, please feel free to reach out to Victoria, or you can email me and I will contact her as well if you aren't able to get a hold of her. Again, just a reminder to please complete the evaluation and the sign out. If there's nothing else, thank you again for joining us. We appreciate you spending time with us today, and we hope you have a good rest of your day.
Thanks, everyone. Take care.